Hello everyone, this is Bob Brown with Community Coronavirus Update number 105. We'll talk about the latest numbers, some confusion that I think comes from, well, misconceptions, speculation, and wishful thinking, unfortunately, and hopefully someday a real strategy. So unfortunately, just lots of headlines this past week. Omaha and Lincoln going to mask ordinances again. Schools closing because of short staffing. Not completely, of course, thankfully, but quite a bit. And just things generally not going in a very good direction. Most schools are closing down at least a day a week just because they don't have enough teachers healthy to cover subs basically. And so this will probably go on for a few weeks, hopefully not too long because we need our kids in school. Hospitalizations continue to rise. The only dashboard I really trust at this point is the Douglas County one in Omaha. They're up to 410. You see they're pretty close to the peak of the last surge. And this is a problem because it's been so sustained. The last one went up pretty quickly and down a little faster. What didn't go down as fast as it went up, and the same thing's likely to happen here. And so this is getting to be a real problem for our hospitals. Um, the CDC, as a lot of people now are saying, the case rates just aren't very accurate. So, unfortunately, when you're the only accurate way to judge how bad things are hospitalizations and deaths, even though that's a lagging indicator. And I like these forecasts the CDC is putting out. The black line is what has actually happened so far, and then trying to project it forward 2 weeks from now. And the thing I'd point out, which I think is good, one, that if you can current trends continue, it's here, but the range of uncertainty is a lot wider. So a lot of the talking heads on the TV claim to know what's going to happen in a month or two. They don't, and so this is why they're only projecting forward a couple weeks, is because there's just so much uncertainty. It's a new virus, a new variant, things behave differently, and there's always human behavior in all of this, and so it's really hard to project with any degree of certainty what's really going to happen in the next 2, 4, 6 weeks, unfortunately. Probably the only good or well, not good, but accurate projections, we're probably going to cross 900,000 dead Americans by mid-February sometime, and potentially even cross a million in March, which is really too bad because that's avoidable with more vaccinations. Here locally, or in our own region, what you see here is Region 7, which is us. This black line here, this is our total hospitalizations. Not quite as high as they had been, mainly because the elderly are so vaccinated, they're not in the hospital as much, but the young are not so vaccinated, and they're what's going up. And this is actually pediatric hospitalizations. And Children's in Omaha is full. Unfortunately, they're trying to use Bryan Hospital for some surge capacity, but when Bryan fills up, what are we going to do with kids? And so that's why I think, even though UNMC's announced, the only one announced crisis standards of care, frankly, pieces of crisis standards of care are already in place all across Nebraska, but some people just don't want to admit it yet. I still like the Bryan Medical Center dashboard, basically kind of illustrating again that Boyd vaccines work, but this actually way underestimates it because of a base rate issue. That although certainly this is more people, this is actually coming from a very small group, so the rates are even worse from the unvaccinated than you might think by looking at simply this visual, and the vaccine works better than you might think by this visual. And so a guy named Matt Donahue, who's our state epidemiologist in his team, they basically ran hospitalizations for all of Nebraska and looked at them at not fully vaccinated versus boosted for the population in each category, and then calculated rates of hospitalizations. And what you see here is that essentially, if you've had 2 shots, you're actually 11 times less likely to be hospitalized. But if you had your 2 shots and your booster, you're actually 46 times less likely. I wish they'd quit calling 2 shots fully vaccinated because it's not, but unfortunately, that's a national bureaucratic definition that hasn't been changed yet. But essentially, if you get your booster, you're 46 times less likely to be hospitalized. They actually went in and did some other analysis, which is very interesting. I think anyway. Essentially, they looked at all deaths in Nebraska and what your death rate was for if you were vaccinated versus unvaccinated. And the lack of being vaccinated doubles your chance of dying in Nebraska, actually more than doubles actually. And so again, showing how effective vaccinations are. And also projecting where we would have been had we not been vaccinated. So if everybody had those same rates of hospitalizations, deaths as the unvaccinated, we'd have 3,200 more hospitalizations and 700 more deaths. Just think how bad a shape our hospitals would be if they had this many hospitalizations rather than this. As bad as things are, it could have been a lot worse without vaccines. So thank God we got those so fast and in place when we did. I just wish we could get more. My quote of the week is Peter Hotez's "Death by Anti-Science," and unfortunately, this anti-science demographic, unfortunately, is leading to a lot of unnecessary and avoidable deaths. Unfortunately, the United States has passed some of the countries that had early on suffered the worst, like Italy and UK, and we might even catch Brazil if we can't get more Americans to get vaccinated, which is really kind of tragic because this is so avoidable. And look how countries like Japan and Australia and New Zealand, you can trust their data. They did really, really well. Canada did much better, but boy, we could catch Brazil, which is really tragic, I think. So, and again, here's some other data kind of echoing Matt Donohue's data from England, basically showing the differences in ICU admission rates by unvaccinated, double vaccinated versus boosted. And you see just a massive difference. And so, really demonstrating the effectiveness of vaccinations. So, we'll kind of launch into some of the misconceptions, speculation, and wishful thinking. A lot of people are speculating and acting like they know what's going to happen. And I think there's a lot of things that are a bit off. One of the big ones is the misconception that Omicron is less severe. It's actually not less severe in terms of its own ability to infect people and make people sick. The reason it's acting less severe is because we have so much baseline immunity to COVID. Had we not had vaccination rates, or some baseline immunity, including natural infection, Omicron would be killing just as many people as prior variants. It's just that we have enough immunity now. This is what is protecting us, actually. It's covered a little bit. One of my favorite sources is this weekly podcast with Dan Griffin on TWIV. This is kind of my working in the yard or driving down the road podcast I like to listen to on Saturdays. And so he does a really good job of covering a lot of this material, and he also is of the opinion it's not that Omicron is less severe, it's that we have enough baseline immunity that's making it less severe, actually. And again, kind of demonstrated, essentially, we're at the point now where almost everybody has had either A, been vaccinated, or B, been infected with coronavirus. So all these people in this orange line, they have, quote, natural immunity, but it just doesn't work so well. Some of these people have actually been infected 2 or 3 times and still landing in the hospital. So vaccination gives you much more predictable immunity. Yes, having had an infection gives you some, but certainly not enough. Otherwise, you'd see these people having 1 and 2 infections not landing in the hospital, but we are still seeing them in the hospital. So the key thing that people forget about the vaccines, they don't give you what's called sterilizing immunity. You can still get a cold from Omicron and turn it into Omicold if you've been vaccinated. The main purpose of the vaccines is to prevent these things, dead, hospitalizations, or complications. But yeah, there's some people who got the vaccine. They think maybe they think it was a waste because they got a cold or a breakthrough. That's actually not a failure. What's a failure is if you got vaccinated, you end up in here. So. So the other thing, again, I point out 2 shots should not be fully vaccinated. It is by a lot of public health sites because they're following an old bureaucratic rule that I wish they would change. The other thing is that so far, I keep hearing people say this is a seasonal virus. Well, so far there's no evidence that coronavirus is seasonal. If we look at prior surges, and here there were 2 prior surges, but they just don't have good data on it. You had the first surge that happened in the spring of 2020. You had the summer surge, and people were trying to claim it was seasonal, but it ran amok in the south. Then we had a winter surge last year, another summer surge this year, and another winter surge. And so the surges seem to happen in any season. Now, I would say the surge can be somewhat seasonal, but that's because the people act seasonally. So you see these big surges in the south in the summer. What happens in the south in the summer is people go inside with the air conditioning. And so it's the people that are acting seasonal, not necessarily the virus, I think. The other misconception that the Omaha surge will pass really quickly and then we'll just be right back down to normal. And none of the experts actually predict that. And even the last surge took a lot longer to go back to the baseline than the rise. And so this is probably going to take a while. It's not going to be a week or 2. It's going to be probably 2 to 4 to 6 weeks, and it may percolate on for a bit longer, especially with our vaccination rates where they are. So. Which then goes on to at least what we really need to have, and I've been honestly very frustrated with both the Democrats and the Republicans. Most of what we're doing is either A, anti-science on one side, or B, very reactionary with not a lot of strategy on the other. And so there you have this op-ed written by Zeke Emanuel, Michael Osterholm, and Celine Gounder. They were actually on the transition time, but I think they're writing this article partly out of frustration because they're just not seeing that we actually have a national strategy for a new normal of living with COVID. And so this is just a 2-page op-ed, but I listened to their full 32-minute Q&A session this morning. It's actually really good, and I think they cover a lot of good points that we need to start thinking through, and I wish somebody at the national, state, or local would start doing a little bit more of this and communicating this to the general public, because I just don't think there's any clear plan on where to go next from our politicians. And they talk about things like, strategies around vaccinations, what I would say call occasional masking. We're not going to be wearing masks permanently. However, we may put them back on from time to time. And I'd say it's like a raincoat. I don't wear a raincoat every day, but I do wear a raincoat when it's raining. And that ties back into a better disease monitoring system. If we knew when the surge was happening, which we could, and we have had it, but people need to put the mask on before the surge hits its peak, not when it hits its peak, which is kind of unfortunate what we did here locally in Lincoln. We waited too long. We need better testing and outpatient treatment. Right now, it's a confusing mess, and nobody knows where to get anything. There's lines, there's shortages. We should have planned for this. And in the future, we may have to talk about better ventilation in general, because this is not the only respiratory pathogen we have to worry about. But we could limit the spread of other things like influenza and RSV potentially with MERV 13 air filters and better air changes. So we may need to think long term about how we ventilate our buildings and how to step up to better air filtration, actually. So it's a good thing, a good podcast to listen through. I think they raise a lot of really good points. And pieces are like this. So I have a friend who runs an urgent care center, and they actually do viral panels, and he sends me his updates every week typically, and it's nice because you can see his site and also versus the Midwest. And so unlike the conspiracy theorists who think, oh, we haven't been looking for influenza, yeah, we've been looking for and testing for influenza all along, and it's just really hardly even there. And here locally, he hasn't had a single influenza case in weeks at his site. There's been a few in the Midwest, but really pretty low activity of influenza. It's still mostly SARS-CoV-2. Human metapneumovirus is actually a worse virus than people think, and this is putting a few people in the hospital. RSV put a lot of kids in the hospital. And of course, there's other coronaviruses but they're minor. They don't usually cause the illness that SARS-CoV-2 causes. So we monitor this stuff, but this should be something that should be available on national and regional dashboards, not just something that he gets in his urgent care. We could put something in place like this. So, if we're going to learn to live with COVID, we need a coherent strategy, and it'd be nice to see, some good policy debate at either the local, state, or national level on how to get here, because I think we have a lot of the tools in place. Some examples I'd use, one is I've in the past I've used this history of my own family about my great grandfather Herman, pictured right over here. Three of his siblings died from diphtheria and typhoid, things we don't see anymore because of clean water and because of vaccinations. And people complaining about getting more than one or more than two or three COVID vaccines. Almost all you listening here to this podcast, you've had at least six diphtheria vaccinations because every time you get a tetanus booster, that diphtheria is bundled into it. We don't have diphtheria anymore because people get six, seven, eight diphtheria vaccines over the course of their life. But another way I'd use is Otto. Otto, you'll notice that he died before all these deaths happened. Well, he died tragically, unfortunately. He was going out to get some wood to heat the sod house, and a blizzard came up, and he froze to death in the blizzard. Well, we don't have that happen much anymore either, because not only do we have vaccinations, we have a lot of other things in place. And so one way to think about learning to live with COVID is, well, how do we learn with bad weather? Well, disease monitoring is kind of like a national weather service. If they'd had some projections that a blizzard was coming, Otto probably wouldn't have gone out like he did and gotten frozen to death. We have testing and outpatient treatments, kind of like 911. If these day and age, if you got stuck somewhere, you could probably call 911. If your car dies and you're stuck in the middle and you might freeze to death, you could call 911 on your cell phone. In hospital capacity and care, that's kind of like emergency search and rescue. When he didn't come home, Anna maybe could have called 911, for example, and they might have been able to search for him. So we have the tools in place. We just should put these tools in place so we don't have as many people dying. Another thing we could think of is should we treat COVID a little like smoking, and honestly kind of let the market settle things out. So for example, if you are a smoker, you can be charged more for your health insurance rates, and other things can be done as well. And so Delta Airlines, I really like their approach. They said, okay, fine, if you don't want to get vaccinated, but you don't have to, but you're going to have to pay for the extra health care that costs. And lo and behold, people, when they realize, wow, I got to pay $200 a month to cover my own health care costs that I'm causing because I don't get vaccinated, lo and behold, a lot got vaccinated. So maybe we do some things to let the market settle this out. And the other things we've learned, we can make things go away completely. So right here we have the Australia influenza updates for the last two seasons, and you'll see two flat lines. Down here is the influenza season last year, which is in blue, and red is this year's influenza season, which means essentially they haven't had it. We've gone 2 years without an influenza season in Australia. We could pretty much do that here too. So a combination of influenza vaccinations and occasional masking might need be a way to make influenza go away completely in the future. The other misconception is there's some assumption that COVID is destined to become a milder infection at some point. We actually don't have any evidence that's necessarily going to happen. And a lot of our viruses don't change over time. Smallpox didn't get milder over time, polio didn't get milder, diphtheria didn't get milder, and so we don't know that this is going to happen. We hope it's going to happen, we don't know it. And so unfortunately, there probably will be more variants in the future. On kind of a humorous note, we have Omicron now. Essentially, they're following the Greek alphabet mostly. They didn't follow it a couple times. We skipped new because, well, if it was the new virus, it would eventually come the old virus and misname the new virus. So we skipped new. Xi was the surname of the Chinese premier, and we didn't want to have any racial overtones there, so they skipped to Omicron. So I guess the good news is the next one's going to be the pi virus, and who's going to be afraid of pi? So we'll see what pi is going to be like coming next. So, in the meantime, what can you do? Well, unfortunately, this is a pandemic of the unvaccinated and immunocompromised. So, if you're unvaccinated, we already know the solution to that. It's called get vaccinated. But if you're immunocompromised, do your best to hang around vaccinated people and step up to a better mask. So, hopefully, this is helpful to you. Again, this is what I do for a living. Disclaimer: these are my opinions, not necessarily of these organizations. And hopefully, this helps.